Good afternoon, thank you for coming. So my name's Isaac Samuels. I'm part of the National Co-Production Advisory Group, which is hosted by TLAP. We're people with lived experience of adult social care and people that care for people with lived experience. So could you please tell me your name and what you do here in Islington?
I'm Sean McLaughlin and I'm the Corporate Director of Housing and Adult Social Services here at Islington Council.
What have you done in terms of co-production in Islington?
Well, I think there's probably two things I'd draw attention to. One is the Making It Real board, and the other one is the Learning Disabilities Partnership Board. The Making It Real board is made up of the council and various other organisations, statutory organisations. The idea was to make personal social care and personal health care a reality rather than just a mechanistic delivery of services through personal budgets. And we wanted health and social care to be personalised in the sense of it being integrated and holistic around real people, and also in the sense of people being in charge of their care. And so we set up that board. And one of the really important things about that board is it's got a lot of experts by experience, either because they themselves use health and social care services or because they're carers of people who use them. And the other thing I draw attention to is the Learning Disabilities Partnership Board, which I co-chair with a rotating co-chair from a group of people who themselves have learning disabilities called the Power and Control Group. And in both of those we want to get a genuine sense of co-producing services and pathways to outcomes for people who use health and social care services.
Can you reflect on what you feel that you've learned?
However experienced you are at providing or commissioning services, that as soon as you're out there and you actually use a service yourself, you see it from a completely different point of view and you get some very special insights into that service. So what we're trying to do is we're trying to harness that expertise that people have through experience. And that's very difficult to do. One of the things we've learned is that it's hard work. You've got to put effort in. You need leadership, you need backing. We're very fortunate to have backing from people like the leader of the council and senior members, people on the board of the clinical commissioning group and so on. You need that sort of backing. You need to put time and effort in. And you need to think about what's in it for people who are going to be participating with you, what they will want from the point of view of their own development, and you need to be able to deal with a period of what we might call constructive venting, or where on both sides there's a little bit of frustration with the way that the other side sees things. So it is hard work, but it's also worth it. You do get much better outcomes. I think that you get more cost-effective ways of delivering and designing services. And I think that you get much better satisfaction as well. I think some of the increase in satisfaction that we've been seeing with services is a direct result of taking a co-production approach.
So thinking about co-production, how do you feel that the organisation has changed in recent years in terms of involving and co-producing with people that live in Islington?
There's a couple of things. I mean, one is that I think that it's becoming the norm for us. I wouldn't say that we're completely there. One of the things that I'm really pleased about is that the approach that we've been taking to co-production within the health and social care sector has been picked up more generally. So the council has recently developed its own corporate plan for the remainder of this council, and it's very much built around the principles of prevention, early intervention and co-production, the sorts of things that we've been piloting. So I think if I've got your question right, you know, you're asking about what we're seeing, and I think what we're seeing is a change in style and a recognition that the best way of dealing with the kind of austerity that we're confronted with is to work with people and work with people in a genuine level, and not to use words like co-production as a jargon for consultation, but genuinely to involve people as equals in the planning and design of their services.
So you mentioned co-production and how it's changed the way the council works with people that access services. Can you give an example of how to avoid making costly mistakes by getting it right or better from the start through co-production?
One example is that we as you know, using direct payments and personal budgets, people are often commissioning for themselves personal assistance. We bought, or were about to buy rather, a system to help people match themselves up with personal assistance, a personal assistant finder system. That was going to be a fairly expensive system. We looked at it and we thought it was brilliant, but then what did we know when we showed it to our colleagues on the Making It Real board who were representing? They found all sorts of reasons why we shouldn't do it that way, we should do it a different way. And that gave us a direct saving immediately on buying what would have been what looked to us to be a good system, but wouldn't have worked in practice for the people who would be wanting to use it. And then an indirect saving as well, because by having a much more effective way of people using their direct payments, we're able to deliver much more economically effective services.
Thank you very much. So Sean, do you have any top tips for co-production?
I think you've got to mean it. As I said, it's not about replacing one word with another. I think you need to have the leadership from the top. You need to have it modelled, not just by people like me, but by the leader of the council, the executive member responsible, the chair of the CCG. We've had the benefit of those sorts of people modelling it. And I think valuing the people who contribute their time and effort and thinking about what they can get out of it, bearing in mind, you know, most of the rest of us are actually paid for what they do. They're giving up their time. We do pay them a bit, but they're not salaried professionals like we are. So what else is in it for them? And we've found that some of the most positive feedback we've had about taking a co-production line has been from the individuals who've been offering up their time and expertise, because they've learned, they've got more confident about speaking in public, they've got more effective at taking part in these sort of commissioning processes, and they're feeling as if they've got something much more valuable going on in their lives as well.
So I'd like to find out what co-production means to you in Islington.
What it means to us is that we are more confident that what we're spending our money on is being spent wisely. We are more confident that if we, in getting things right in the first place, we are more confident that if there are things that need to be put right, we will reach that conclusion more rapidly. And we're more confident that we've got a sustainable way of developing services for the future.
Thank you. What advice would you give to a Director of Adult Social Care about co-production? I
think this is one of those things that you can't delegate. It's one of those things that you have to be seen to be doing yourself.
Okay, so the Making It Real co-production group, how did they come together? How did you start co-production in Islington?
That was quite a lengthy process. I mean, we had a number of other fora and means of communicating with service users, with carers and so on, and we also had an Islington Personal Budgets network advising us on personal social care, which we kind of expanded when the CCG was developing along with us personal health budgets. And from there we develop more sophisticated ways of getting good representation from different service interests and different parts of the community. In answer to your question of do I have anything to add, I mean, I do want to emphasise that we don't think that we've got co-production cracked in Islington. Obviously it's great if people think we're moving in the right direction, but there's a lot we still need to do to make sure it's embedded in the thinking of all our commissioners and all our service providers. And particularly I think that we struggle, and we would really like to learn from others on how to improve our co-production when it comes to working with very elderly people, with people with dementia, people who are using health and social care services because of consequences of a traumatic incident or a fall or something like that. I think there's a long way to go, but the thing I would say is that the journey we've been on so far demonstrates that there is a lot more to be gained from a co-production approach if we can crack even in the more difficult to reach people who use our services. Yeah.
Thank you.